Hi, Michelle.
Hi,
Welcome.
thank you for having me.
Over the past few years, innovations have been made to improve behavioral health. I've seen it here in North Carolina. There's been a lot of different little interventions of innovations across the United States. And I've talked to a couple people now on the show for mental health, and they've said repeatedly that one cannot approach behavioral health as a one size fits all kind of thing. And outside of this conversation, we talked about how technology integration has been poorly suited to behavioral health's unique needs. So, can you give us a brief overview of what you believe has brought us to the challenges that we see now?
Hmm. Yeah, so I'm going to go back a little bit to tell you how I came to be working with technology because I think it matters in the context of this. I was working for a healthcare company in Connecticut at the time, and I was doing work on innovative health. We were targeting integrative health, things like um, acupuncture, yoga, music, art. We were looking at different avenues to help people in recovery from addiction and mental health. Our traditional way is to kind of sit in individual therapy or group therapy and literally sit for hours on end, which is very challenging for people in early recovery. Both thinking is challenged at that time, and also just physically, it may be hard to do physical activity, but also may be hard to sit, depending, on your symptoms. And so we were trying different things, and really a lot of promising things there. And then as I was working there, I was overseeing a treatment program and an outpatient treatment program. And one of the things that we wanted to look at was technology. What about technology? It's become a part of our everyday lives, and how can we leverage it to make a difference? So at the same time I was looking for that, there was a company that I work for now, Tricycle Data Systems, that was looking for a partner to pilot a tool that they had. And so I took on my own caseload and wanted to see how it worked myself, because I was going to be asking my staff to do this, and I was going to be asking clients to do this. And I really wanted to kind of dig in there myself. I'm kind of a hands on person. And so I did that. And I'll tell you, in 25 years I had been working in the field, I really hadn't seen a whole lot change, other than we had been trying some, these new things were coming in that were pretty exciting, such as I just said, like the acupuncture and yoga and things like that, which are also, I think, really, really important because there are many pathways to recovery. But when I saw this, what was unique about it is my experience, and I think it's probably fair to say it's many clinicians' experience. When they hear the word technology, we tend to shut down because it's usually not helpful to us. People tell us it's going to be very helpful to us. It's going to streamline things. It's going to make things really efficient. It's going to be all these wonderful things, and it never is. And it is always something more we need to do. It's distracting. We tend to not have the best view of it. I'll speak
Yeah,
for myself.
yeah.
People
Well,
feel
it's like
different.
you're trying to learn something new, most likely, especially if
Yeah.
you're not really tech savvy. So you're going to get more frustrated than you are going to feel like it's actually helping you.
Yeah, so it kind of feels like it's
Yeah.
getting in the way.
Yeah, yeah, a
But what
bit.
my
Yeah.
experience was, and I really felt like I can't ask people to do something I'm not willing to do. So I really kind of wanted to see it myself first. And what was interesting is it was helpful for both clients and clinicians at the same time. That's not easy to do. Usually we tend to focus on one or the other. And it might be really great for clients, but it's like a lot of work for clinicians. Or it might be great for clinicians, but the clients don't really want to do it. And so what I saw was something that spoke to both those people. And I realized, hey, somebody took the time to listen to people who are early in recovery and also clinicians, and what it's like to try to get their work done. It is a very challenging job in a really dynamic environment where things are moving fast paced. It's not like people come in, sit down, we help them, and these 10 people go through treatment for 10 weeks together and then they leave. I mean, it's people coming and constantly coming and going, and we're managing their different symptoms, they're changing levels of care. It's very complicated. And so this was a tool that made things very simple. It helped. It helped, like if clients come in, they don't want to keep telling people the same thing over and over again, right? So things like that, where clients didn't have to repeat things over and over again. The whole team was aware of something simultaneously. Clinicians also don't have the time to catch up with each other, make sure that we're all moving in the same direction with a client, or if there's multiple people working with a client. So things like that. It's also, I think technology is great for, you know, if I'm a client who is in early recovery and I go to treatment and that's 9 to 12 o'clock, I might not be struggling most at 9 to 12 o'clock, but that's when treatment is. And so treatment's helpful, but I might need somebody at 4 o'clock or 8 o'clock. Maybe it's when I got off work, that was my struggling time. Or maybe when it gets quiet at night, it's 8 o'clock at night. Maybe that's my struggling time. And so, technology allows us to connect with people um, outside the box. It doesn't have to be quite so confined. It allows us to bring in people like recovery support specialists, recovery coaches into the mix and have a voice. And that's really important. It allows clients to speak when after maybe they need a little more time to process. Maybe they're a little more shy and they couldn't think of it in the moment, but they think about it later. Right? So it gives them a voice. It allows them to share, I need you to hear what I need you to hear, rather than sometimes when they get in front of a clinician, there might be a little bit of a hierarchy that they feel, right? And they feel like they're supposed to say what they're supposed to say. But later, when they have a little bit more space and time to process, they have some thoughts that they want to share, and they find their voice, right? So technology can help us bridge that gap, because a lot of times you'll hear people say, oh, a client isn't, oh, they're just not ready yet, or they're not being compliant. And that might not be the case at all, right? It might just be that they haven't found their footing yet. And our job is to help them find that place, like bridge that gap and help them get there. They don't know how to do it. They're coming to us for help, right? So technology can help us kind of bridge those gaps. It can help us identify risks that maybe we can't see because we can't be with them all the time. And when we ask somebody how they're doing, they have to reflect back. How are they doing? Whether that be yesterday, 2 days ago, 5 days ago, that's hard to do. But if I'm in the moment, I can tell you how I'm doing. And then we can start to see patterns and some things that we just couldn't see without technology. So that can be a really helpful thing.
There's it gives the ability for the client, or through the patient, the patient, to feel empowered to do more, it seems, instead of having to rely on certain old norms. And then the other thing is this whole aspect of technology helps create an environment where it has that patient-centered approach. That way it's not feeling so monotonous and just like I was saying earlier, like one size fits all kind of thing. So it's nice to see how technology can make things better. And I kind of wanted to dive into the next portion of this, where we're talking about integrative wellness practices to promote overall well-being. So can you talk about what approaches are fully needed to support clinicians and patients in this instance?
Oh, I think the sky's the limit. I don't think I could probably think of all the things. I might, as I list things, people would say, well, what about this? What about that? My view is, if I'm working with a client, and I refer to them as client, depends where you are. Some people call it client, some people call it patient. Patient to me means you're going to be sick for a long time. And I look at it like you're coming, we're partners, and we're going to work this recovery journey together. So I look at it as like, well, tell me about yourself. And if I learn that you like music and that's your jam, then I'm going to work with you to figure out, how do we apply recovery in a way that, like with music, how can we make that work for you? Right? Because what I don't want is for people to think about, sometimes we get so monotonous in our treatment that people will actually refer to it as a class. Oh, I'm coming to class, or I'm almost done class, or they look at it as their teacher. And that's great. We want people to get education and we want them to learn. All of that's great. But recovery is a 24/7 way of life. So we want to set them up for success. Not like you're doing great here, but the minute you leave here, you're fumbling. And then you have this cycle where you just keep coming back, keep coming back, keep coming back. So we want to set people up for success. So whether that's drumming or any kind of music, we worked with a client one time. Violin was there. They were a violinist, like a professional violinist. So we figured out ways to like bring that into their recovery. Art, how do we bring that into the recovery? Yoga's really important, and there's such a wide spectrum of what that means today. But helping people understand how to move, you know, their body so that the trauma doesn't get stuck in their body and move that through. And so whether that's yoga or any kind of movement, we can do that. But like we teach them to move a muscle, change a thought. That's a recovery concept. And so we can bring that into it. Acupuncture is great, again, for kind of like moving energy, but also like even just being in a meditative, um, like a chair where you get acupuncture done, just taking that pause where you learn to take a pause, take a breath. It is literally limitless. If you picked out anything in the room, you pick out a book, you pick out a sand tray, you pick out you name it. We can apply it to recovery. I really feel like it's our job to help unlock that for folks. Find that little spark. There's a spark in there somewhere. Otherwise, they wouldn't be sitting in front of you, right? So at minimum, they can't. They showed up. So there's a little flame in there, and it's our job to kind of fan that flame and figure out how to keep it alive and grow that, so that they can uh, begin a new life of recovery that's sustainable.
Yeah. And I can totally like 100% actually like give like a personal experience because I'm in acupuncture. Went into acupuncture because I was having this pain in my neck and it would
Mm-hmm.
cause unbearable headaches that I couldn't look at my screen like I'm looking at you right now. I couldn't do it.
Mm-hmm.
I couldn't drive. Like still kind of can't drive long distances, but a family member was like, just go and see what it's like. And she's like, at first you may not feel it because you kind of have to buy into it. You have to buy into the, how it functions, how it works, how it can make you feel, and just really take the initiative to work through it. And because it's also a mental thing, it's mental,
Yes.
physical, that moving of the energy. And yeah, I haven't had this pain in like 3 months now. So
That's
I
awesome.
could speak to how it works, and it's
Yeah.
fantastic.
Yeah. Absolutely. And I think it's a really important concept that you bring up, like this openness and a willingness, right? And so we have to get in that mindset of willingness, and that is unlocked different ways for different people, right? When we tell people you need to like sit down, do it this way, this is the only way, like many people would rebel from that. Like, especially, you're an adult, you want to be able to, you come in for help and you want guidance, but that doesn't mean you want somebody to direct every single thing, right? You want somebody to help guide you and partner with you, right? Rather than dictate that there's only one way to do something, because that's not true for
Mhm.
any of us.
Correct.
Um,
Yeah. That one size fits all thing. It's just not, it doesn't make sense in that narrative because I haven't actually done yoga, but like, I feel like with all of these different wellness
mhm,
solutions, it is mind opening and it's another form of that healing and that
mhm,
path forward. It's, whenever I think of treatment, just that's just my first thoughts because I don't know if TV shows, movies, things like that influencing me on it, but I do think of sitting around in a very dimly lit room, all of us
mhm,
sitting in a circle and talking about things, or
mhm.
the famous chair, the lounge chair. You wait,
Yeah, the sofa.
the guy's got a notebook, writing stuff down, and unfortunately, that's also aligned with therapy, but it's
Mhm,
just what I think society has shaped. This is what that looks like, and it doesn't
mhm.
have to be. It doesn't have to
Right,
be.
and there's a time and a place for that, right? There's nothing wrong with that. That can be really helpful too. It's not everything, right? It's not the answer for everyone all the time. I use an acronym, SPIES, and it's spiritual, physical, intellectual, emotional, and social. And these are the areas that all of us, to be healthy, have to consider on some level. And it has to be right for you, right? What's right for you in physical and right for me in physical may be something totally different. But it's just, how do you build that into your life? Where do you find that? Again, so we're looking for a way that you can be happy and healthy and it's sustainable. If you don't like it, it's not going to, you're not going to keep doing it, right? If somebody says to you, like, let's take somebody in recovery from alcohol or other substances, and we say, don't use, just don't use. But how long could that last? I mean, that's kind of a torturous life. Don't use, don't use, don't use. I mean, that's not living. I mean, it might be necessary at the very, very beginning to tell yourself that, but we have to go beyond that. Okay, what am I doing? It's not what are you not doing, it's what are you going to do. So we want to look at how do we build the life not just extinguish something that we want to go away.
Yeah, the action path to enlightenment in the healthy, sustainable way. I mean,
Mhm.
that just it makes sense and it makes sense on paper. It's just implementing that and
Mhm.
sticking with that process. I think with blending these two things, some people can kind of get a little into the weeds on it, like how it what it means to have technology with wellness based care. Do you have any do you see any difficulties with people being able to people being clinicians achieving that for their patients?
Mindset, really, mindset is it. The technology is so simple that it's not any harder than anything anybody's doing now. No harder than checking an email, right? So it's not anything that takes a lot of time. It's not anything that's difficult. I think it's more getting over the mindset because historically, like it hasn't been great. And so being willing to open your mind to say, hey, we've come light years. I mean, where we've come with technology in the last few years compared to 20 years is, I mean, night and day, right? And so this is where, and people are using like their phones. This is where they do things, and so we do have to meet people where they're at. Um, and so I think it's important that we keep our minds open and give it a try and see, how simple it is and the difference that it does make for both clinicians and clients. Um, and I think the other thing too is I didn't talk a lot about it, but the recovery support specialists are pretty important. People who have lived experience who can support both clinicians, taking some load off of things that they need to do, but also are the voice, you know, um, of experience of having actually lived it, right? And so that person in recovery has access to somebody who provides, true hope. Like, okay, if they did it, I can do it, and can kind of help them through those challenging times. And for them to stay connected through technology is key.
Yeah. And one thing I'm going to look at, I have my little outline right next to us. So there's
Mhm.
one thing that you said that I was thinking of. Well, and having someone with them, and whenever we were building out this conversation, I
Mhm.
really like honed in on the word empowerment.
Mhm.
And talking about someone's lived experience, it can help that other person find their empowerment, that willpower
Mhm. Mhm.
to continue onward.
Mhm.
And I just that I hone in on that a little too much because we're talking about creating this environment where people feel heard, supported, and understood.
Mhm.
And without those elements, I feel like there would be some pitfalls. Maybe
Mhm.
I am not a clinician in any way, but me thinking about creating this environment, there's a lot of challenges in doing this. And I always say to my guests, like, what's one thing you would do to make something better? And I don't feel like there's one thing you can do.
Yeah.
So, I mean, if we could kind of address what would be the right things to do for your patients, creating this environment, can you, to give the audience an understanding of, being feeling heard, supported,
Mhm.
and understood, can you explain on how this should be done?
I would say probably most simply listen. And that sounds like it's simple, but it's not. If we had people who were really effective listeners, we'd probably have different results, right? It's really not easy to do. um, it's simple but not easy to be in truly in the moment when there's all these things going around and your time you're pulled to go so many different directions and really staying in that moment. um, so that is why things like technology can be helpful, because none of us has time to sit down individually with people for hours on end every single day. We just don't. We would love to, but we don't, right? We can't be with people. We could probably spend hours with in one individual person each day, right? Like there's just not enough of us. So if we can listen with intent, listen authentically, that's really, really important. But also like leverage technology to kind of have quick hits with people where we can touch base with them very quickly. To stay connected, I think is really, really important. And people feel heard when they have that connection, right? So it's not this like these big ups and downs where we leave and we come back and we feel like we need so much at this time. We just need little bits consistently. Consistency is key in working with folks. Um, and I think those three words that you pulled out were like spot on, to feel heard, supported, understood. And we can do all those things when we get the support of tools that can kind of help bridge the gaps when we can't physically be there, like right at that moment. But it doesn't mean that I didn't hear you, right? So maybe it's an hour later, but I can connect with you. We still feel connected because there's still this, like, there's a thread that we keep going, um, where we stay connected and we feel heard. So, and that's the whole point of it, is to help people feel empowered in their journey, in their recovery, right? So it's not you come to me and I fixed you. Like
Well, there's no way you're going to be immediately fixed after a session. And my
well, you're not
acupuncturist
fixed,
reminds
period,
me of
right?
that. Yeah, it's a ever working process. Like
Right,
you're going to keep working on it for a
right,
long time.
right. I mean, there's not anything inherently wrong with you. There's like some things you got to tweak. So yes, there's some issues that need to be addressed and you need support with. But as a human, um, you're you. Like, and this is just part of you. So we're going to figure out how to use that part of you in a way that is maybe a little bit more productive and healthy for you.
Mm-hmm. A
And so
better part of you.
yeah.
Yeah, yeah.
Mhm.
At the end of the day, it's to make you feel better and to do better.
Mhm.
Do better for yourself, really. Do that because, like, my acupuncturist will get on me a lot. She'll always say, getting used to letting things go, understanding you can't control everything, that everything take good things take time. And I'm like, okay, I'm gonna
Now,
take
can
in
you
all
imagine
that.
if you had your acupuncturist with you in between sessions, right? So you have your actual physical session when you're there. Now, can you imagine just touching base or her sending you a quick note like that? Like, how's it going letting go today? Or don't forget to let go today. Or tell me about how you let go today, or whatever. But you just had these little kind of quick hits in between. Like, let's say you see her weekly or monthly, whatever you see her. And a couple times in between, you were able to stay in touch, right? So now it's not like you deplete all the way and then you come back and she does her procedure and talks to you and you feel great. But can you imagine if you kind of had her voice with you? You have those little connections in between,
Mm-hmm.
right?
I feel like it would be so much more than the little sticky note I have that's sitting over there reminding me, like, I need to do this every day, or my little amethyst rock that sits on my desk. Having her voice, I think, would make me feel better. It's that reaffirmation of, like, or not even her voice, just that, like you said, with the connection, like her
Mhm.
popping up on my phone to be like, oh, hey,
Exactly.
it
So
would be
sticky
that
notes are
boost.
great. They're great reminders, right? Use them. We use all the tools that we have. But there's something about, like, there's an energy behind if she reached out to you, right? Um, through technology, there's an energy behind that versus a static sticky note. And so there's the human element. So the important part is with technology, what we're looking to do now is how do we increase not just connection, but the human connection, right? So not bot technology, like human connection. How do we use technology to our advantage to increase human connection? Because that's what people need. We are meant to be, we're social creatures, we're meant to be together in community. And so that's where you see technology going, is to beef up the human
Yeah,
connection, not take it away. And I
not
think
take it
that's
away.
probably a fear of people when they hear technology too. They think it's going to take something, like streamline it, make it more efficient, take the human piece out. But what we're seeing with technology now is no, how do we increase it? So even if you go to see your primary care doctor, right? And technology takes notes, right? Now that means your primary care doctor can look at you. They're freed up to look at you because technology is taking care of that other piece of it. That's how we want to look at technology. How do we increase the human connection?
I mean, once when you were talking about the how technology can, and people with a negative mindset, I forgot how we have been seeing a lot of people trying to push away from human connection because it's so much easier to just take your phone and doom scroll. But you don't really get anything out of that. You don't get anything meaningful, but just by scrolling, you get neck pain. I don't. That's That's not where my nickname came from, but you get hunched over and
Yeah.
you become a shell of a
Hmm.
human. You're not out there talking to people and socializing and building a community or even having that social boost of
Yeah, and I
serotonin
think we saw a
excitement.
lot of that out of necessity during COVID. So it became a lifeline. It became a great thing. But then we went probably a little too far. Like we didn't stop using it. I think what I'm observing is you're beginning to see the shift away from that kind of mindless, use of it, and recognizing that limiting it or finding other ways to be, with humans, or being selective, just being selective about, like your television's not bad, but it's like, what are you watching on your television?
Yeah. Yeah.
Right? So,
Turn off the news.
so you're using it to find something that's filling you up or depleting you, right? And so, same thing with any kind of technology.
Yeah. There's so many things we can do on technology. And I feel like what will come a part of the future is I will bring you back on and I will see if we can pull two of our other previous guests and have a tech standoff.
Cool.
Let's see what innovative things that they've seen and how it's helped them. Because I'm thinking of two folks that are wonderful folks that I'm like, oh, we need to do a discussion because this is such an expansive topic and we can go back and forth and see how it's helped, in rural communities, how it's helped
Hmm.
in
Yeah.
this,
Yes.
adolescence and things like that. So
Yes.
think of it for the future. Think of it for the future. But that's everything I have for you. Thank you so much for being on the podcast with me, Michelle.
Oh, so great to be here. Thanks, Liz.